Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast, which I call the Common Sense MD. Today I'm going to talk about something exciting for me because I like to talk about nutrition. I like to talk about chronic diseases. I'll tell you what, I couldn't be more excited about the changes I think will happen with our healthcare system with this new administration going in January. I mean, there are some heavy hitters that I happen to like and I agree with them that are coming in to, I hope, reform our medical care system in this country because it's good and it's bad, and I'll talk a little bit about that. But the other recent book I read, I'm always reading and researching things, is a book by a Dr. Casey Means that I've listened to her podcast through the last few years with Rogan and some of the other heavy hitters, and really I agree with about everything she says. I mean, I've been practicing medicine this way for the last 18 years of my practice, out of my 40-year practice. So, I mean, I agree 100% on the philosophy and some of the nuances of how to stay healthy because she's right about this. Our country is not getting healthier. It's getting more unhealthy, more obese, more insulin resistant, more metabolic syndrome, which we deal with every day in our office. But in any event, today I want to talk about processed foods. And because you need to know what this is and you need to avoid them. Again, we've been misled by our misguided industrial government food insurance complexes that really have led to the unhealthy state of our country, starting with our kids and our adults concerning their health. It's resulted in an obese nation with many chronic diseases. Don't get me wrong. We have the most advanced diagnostic tools, surgical procedures, life-saving trauma specialties, even advanced life-changing pharmaceuticals are out there. But despite this, we're one of the most unhealthy nations in the world. And it all starts with what we eat. Our medical system is the largest and fastest growing industry in the United States. Think about that. More than the oil companies, anybody, our medical system is the biggest industry that we have. It's getting bigger. Yet our population is not getting healthier. It's getting sicker. And the money is in treating sick people, not in prevention. Is this intentional to keep people sick? I don't know. But I know there's more money in it, for sure. And somehow it's just evolved this way. We have to change this. Who's to blame? I think it starts with the food industry for many, many decades. A lot of misinformation that they've plied us with, advertising, just wrong information about what to eat for sure. So let's talk about processed foods and how it's wrecking our health. You need to know what these are, and you need to avoid them at all costs. I treat obesity. Really, that's the reason I started performance medicine. For 20 years before that, I was just a regular doctor prescribing pills for hypertension, hypercholesterolemia, diabetes, depression, blah, 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 everything. Then I started noticing that really none of these patients felt any better with these medications. And a lot of them felt worse with all these medications. They just weren't helping much. Then 2 of my own children came down with type 1 diabetes. And I soon realized that I knew nothing about nutrition. What I thought I knew was completely wrong. They don't teach it in medical schools, and what they teach, what they're still teaching, is completely wrong. You need to realize that. Look at the food pyramid. Anyway, I took a deep dive on nutrition, and I still study it every day. And I see it in my office. So I'm at the perfect spot to experience it, not only by myself, but all these thousands of patients that I treat for obesity and metabolic syndrome. So I've totally changed the way I've practiced and the way I look at things. I want to prevent these chronic illnesses that are increasing in our country, not just treat them. As you know, many diets work and many fail. I don't care if it's carnivore, keto, vegan, vegetarian, Mediterranean, all plant-based. I think the main culprit, really, in our chronic disease state is processed foods. Think about that. What's an unprocessed food? First of all, what's an unprocessed food? The good ones. Unprocessed foods undergo zero alteration following their removal from nature, like eating an apple right off the tree. Whole foods, the lack of added ingredients to foods like fruit, vegetables, eggs, nuts, seeds, dried herbs, spices, and raw cuts of meat, poultry, and fish. They're unprocessed or minimally processed. By minimal, I mean there may be some processing like washing, crushing, grinding, filtering, roasting, canning, boiling, vacuum sealing, freezing, non-alcoholic fermentation, pasteurization. In other words, no part of the food has been stripped away or concentrated, and no extra salt, sugar, or other ingredients have been added. That's what I mean by unprocessed foods, or minimally processed, which are probably okay. Now, on the next line of the chain is processed foods. Now, by processing foods, they increase the durability and sensory qualities of foods by combining minimally processed foods with processed culinary ingredients like oils, butter, sugar, maple syrup, lard, salt. Now remember, some of these minimally processed culinary ingredients like olive oil, you got to be careful, some are adulterated, and avocado oil are made from squishing fatty whole fruits rather than mechanically and chemically extracting them. They're oils from like seeds or vegetables. Those are the bad boys. Those, along with high fructose corn syrup, are the worst. So processed foods may be necessary in some cases, so you got to be careful with them. Then the easiest way to identify processed foods is really by looking for oil, salt, or sugar on the label. And also note this, if you can't understand what a label is saying, the ingredients in them, the chemicals in them, or the label, or just a ton of stuff in them, you probably should stay away from these foods. You should also stay away from foods that are advertised, in my opinion. But it can surprise you what's in ketchup, salad dressing, peanut butter. So you need to avoid processed foods with refined vegetables or seed oils, refined grains, added sugars, or anything unrecognizable. Now, the real bad boys, the ultra-processed foods, which is most of what people eat. Now, these are the so-called frankenfoods created in industrial factories by combining adulterated parts from different foods with synthetic ingredients like preservatives, food colorings. They may add hydrogen to oil to make a fat solid to prevent it from going rancid. These foods include mass-produced versions of pastries, breads, cakes, cookies, nut milks, nuggets made of ground meat or soy, chips, crackers, granola bars, snack foods. I'm going to print a list of these out for you to get you a bigger list of these things so you can look at them. By avoiding added sugar, industrial seed and vegetable oils, and processed grains, you can avoid most ultra-processed foods just by leaving those out. Many of the additives in America are ultra-processed foods. They're really outlawed in other countries. It's amazing what we are able to legally add to these foods that are totally illegal in other foods. I'll tell you a story. My two diabetic kids, Andy and Kelly, traveled to Europe last year on different trips, and they're type 1, so they have to monitor their sugars continuously. And when they were over there, they told me they ate most everything they wanted to eat, and their sugars were very even. They didn't budge a whole lot. And I think a lot of it is because the added ingredients that we put in our country here. Andy's rash also went away. So I'm pretty sure he's got eczema because of some of these food additives over here. Like Red 40 food dye. That's one that, in fact, any food that has red, blue, or yellow dye in the ingredient list, you should avoid. There are many natural food colorings like beet powder, spirulina, turmeric that are way better. That's what most of these other countries use. Ultra-processed foods make up 60% of calories consumed by adults and 67% of the calories eaten by kids. That's a lot. I think that's the major reason that 93% of adults in the United States have some degree of metabolic disorder, i.e. insulin resistance. And again, they've taught us the wrong things. There is no major benefit in adding grains of any form to your diet. And we've been taught to eat whole grains. Most grains, in addition, are adulterated and covered in toxic pesticides, mostly glyphosates, think Roundup. So we've been totally misled by the food industry, and they have basically control what our government recommends to us. And that's what's advertised to us as well. So it's kind of pitiful. So you need to think about this hard. If you want to be healthy and avoid chronic diseases, avoid getting obese and having diabetes, hypertension, lipid problems, arthritis, and a lot of these autoimmune diseases that we see in our office every day that start in the gut, think about these ultra-processed foods. And I've just barely touched on this subject here, but I want to challenge you to look at what you're eating. And some people, make no mistake, they will need medical assistance with this from somebody who knows what they're doing. More like an integrative or functional medicine place like we have. What I would suggest is starting with some basic things like a Cleveland Heart Panel. In this panel, I can see how insulin resistant you are when you've been told your A1C is normal. I actually check a HOMO-IR insulin resistance number, an actual insulin number, C-peptide, in addition to many of the other metabolic markers like inflammatory markers. And one of the best things I do on this panel really is check your fatty acid analysis. I can tell what your ratio of the good omega-3 fatty acids are to the bad inflammatory omega-6s. I really look at that pretty hard. And a lot of people don't even have a clue they have a high level of omega-6s. That's why I recommend some of the good omega-3 supplements to people. I do think people need supplements. It's very hard to get enough through your food, believe me. So I'd start with a basic Cleveland Heart blood test panel. I'd get an in-body analysis. We have these at our offices, one in the Tri-Cities, one in the Knoxville office, or you can go to some other places and get this. But it's a very accurate, what I call truth-telling machine that will measure not only your body fat percentage, but your basic metabolic rate, how much water retention, how much muscle you have in each appendage. But the most important thing is how much visceral fat you have. A lot of times you can just look and see that you have it because you have a big belly and your waist size is expanding. So I'd get the in-body analysis to see where you are. I would wear a CGM. I've done it many times. Of course, my diabetic kids do it. I'm not diabetic, but it's been very helpful for me to wear these continuous glucose monitors. Now you can get them over the counter. It'll really tell you what foods spike your blood sugars high. I mean, it checks it for 2 weeks. It's painless. So you put it on the back of your arm. We've demonstrated this in many podcasts. But get one and see what foods raise your blood sugars and spike you, because that's where the damage is in the spiking. If your average sugar on your A1C is normal, which doesn't mean a lot, then you're still probably spiking, and you may be surprised what spikes you. And people are different. A lot of it depends on your gut microbiome, your genetics, and your current metabolic rate and amount of insulin resistance that you already have. Because most of us have some degree of this, like I said. So I'd wear a CGM, and I would do a food diary and just write down what you're eating. So you need to start thinking about these things if you want to be healthy. So again, the first pillar of my things that I look at for you in my practice is, number one, your food. Number two, it'd be exercise. Number three, sleep and stress. Number four would be hormone balance, especially as you get older. But food, to me, is the most important thing. And that's what's driving this chronic illness plague in our country. So think about all this stuff. Do some good reading. I like good energy. There's a ton of good literature out there. But talk to somebody who really knows what they're doing with this metabolic syndrome. And look at your processed foods and get rid of definitely the ultra-processed foods in your diet. Thanks. I'll see you again next week.